on school safety and truancy, was to call this second oversight hearing of the committee during council period 19 to order. It is now 9:55 a.m. We are meeting today to conduct a public oversight hearing on the topic of school safety and truancy. Started this end with Ms. Sandalo, and if you can make sure each of you, when you start your testimony, to state your name for the record. Thank you.
Good morning, Chairman Biddle and members of the Special Committee on School Safety and Truancy. I'm Judith Sandalo, the Executive Director of Children's Law Center, which is the largest nonprofit legal services organization in the District of Columbia and the only such organization devoted to a full spectrum of children's services. Every year, we represent more than 1,200 low-income children and families, including children in foster care and children with special education and health care needs. Through this work, we interact with many hundreds of children struggling to attend school. I'm so pleased that the Council has formed this special committee to bring attention to the issue of truancy and the ways we can work together toward solutions that will support children and families and lead to improved educational success. As you know, children are truant for a wide variety of reasons. Understanding the complex and varied factors that lead to truancy is critically important to crafting appropriate intervention strategies. Research shows that truancy results from problems in three separate areas: personal problems, problems at home and in the community, and then problems in school itself. Each set of problems requires a separate solution. My written testimony goes into quite a bit of detail about all of these areas and proposes many solutions, but in my limited time today, I want to briefly discuss two priorities which I believe are the most important first steps the district must take to reduce truancy: improving our mental health services and implementing what's called differential response at CFSA so they can be a true partner in this work. One key thing the district should do is to reduce truancy is to improve mental health services. Children in D.C., especially those living in poverty and facing other challenges, have a high level of mental health needs, and our mental health system, while improving in recent years, is still quite broken. The system is too complicated and fragmented, and families struggle to obtain timely services. In addition to improving the overall functioning of the children's mental health system, the Council should work with DMH to ensure the district's mental health system is able to provide evidence-based mental health treatments, which are proven to address issues related to truancy. Some examples include family functional therapy, parent-child interaction therapy, and multisystemic therapy. There are also other interventions aimed at parenting skills which the district could offer, and I detail more about them in my written testimony. Finally, the district should expand school-based mental health programs because clinicians in the school obviously are best situated to work with the schools and parents and children together. At times, a child's truancy is due to larger family and community issues, and these need to be uncovered and resolved. When school-based interventions have failed to improve a child's attendance, involving the Child and Family Services Agency may be necessary. Last June, the Council passed the Families Together Act of 2010, which would permit CFSA to respond more effectively to thousands of child protection hotline calls each year. The law allows CFSA to adopt what's called a differential response model, which means they can triage hotline calls, responding differently to low-risk situations than they do to high-risk urgent situations. The model is particularly appropriate for cases involving truancy, where there's no immediate risk of physical harm or high level of neglect to a child, but the family is in important need of services. Differential response leads to better outcomes for children and families because it permits CFSA to build a collaborative rather than an adversarial relationship with families and to get them services immediately, especially where it might address truancy problems. Unfortunately, the bill was passed subject to appropriations and funds were never allocated. The fiscal impact is slight, only $775,000 over a 4-year period, and effective implementation would save money in foster care costs and thus save the district money in the long run. We urge the Council to fully and effectively implement this legislation so that CFSA can be a productive partner in reducing truancy. Thank you for the opportunity to testify, and I'm happy to answer any questions.
Thank you.